Welcome back to Insurance Clarity with the Angulo team. My name is Sebastian. Today I want to walk you through one of the most important parts of your health insurance and one that causes a lot of confusion, the deductible. And as we go through this, I'll also briefly clarify how it's different from the out-of-pocket maximum because those two often get mixed up. A deductible is the amount of money you pay out of pocket first before your health insurance plan begins to share the cost with you. The deductible is not what you pay total, it's what you pay first. You can think of it as a threshold. Once you cross it, your plan begins helping you pay. Now there are some exceptions we'll touch on, but let's start with a simple example. Let's say your plan has a $1,000 deductible. That means the first $1,000 in covered medical services you are responsible for. So imagine you go in for an x-ray and the bill is $200. Since you haven't paid anything toward your deductible yet, you would pay that full $200. But that money is not lost, it is applied toward your deductible. So now instead of $1,000 remaining, you have $800 left in your deductible. As you continue using medical services throughout the year, those costs keep adding up toward that deductible. And once that deductible is met, that's when your plan begins to share the cost with you. At this point, a very natural question comes up. If I have to pay the deductible first, why even have comprehensive health insurance? That's a fair question. And this is where things can feel a little confusing because not every medical service requires that you meet the deductible first. In fact, many plans cover everyday services right away, usually with just a copay. For example, preventative care, like your annual checkup, is often covered at no cost. Primary care visits usually have a small copay. Urgent care visits often have a set copay instead of the full cost. Generic prescriptions are typically covered with set copays depending on the medication. Telehealth visits are often low cost or even $0, and in some plans, even specialist visits or mental health visits may have a copay. So if you haven't met your deductible yet, you're still able to access care without paying everything out of pocket. However, larger services usually do apply to the deductible first. Things like emergency room visits, hospital stays, surgeries, some tests and imaging, MRIs, and CT scans. Let's walk through an example with the ER. If you had a $3,000 ER bill and a $1,000 deductible, you would first pay that $1,000 out of pocket. Then, if your plan shares costs, for example, 50-50, you and the plan would split the remaining $2,000. So in that case, you would pay the $1,000 deductible plus $1,000 your share after, and then the plan would cover the other $1,000. Because the deductible was reached, future medical services will no longer require the deductible for the plan to share costs. Now let me briefly clarify something important. Every plan has something called an out-of-pocket maximum. And this is what protects you from those worst case scenarios. It's a cap on your financial responsibility for covered medical services, so you're not left dealing with tens of thousands of dollars in medical debt. Many people confuse the deductible with the out-of-pocket maximum. They are related, but they're not the same. Once your deductible is met is when cost sharing begins. The out-of-pocket maximum is the most you would pay in a year for covered services. Once you reach that maximum, your plan pays 100% for the rest of the year. We'll go deeper into that in another video. So as you think about your coverage, it can be helpful to remember the deductible is your initial responsibility. After that, the plan begins sharing costs with you. My goal with these videos is to help you feel more confident in how your plan actually works, so there are no surprises. If this was helpful, feel free to like and subscribe so you can catch the rest of the series. And if you know someone who could benefit from this, go ahead and share this video with them as well. If you ever have questions about your specific situation, we're always here to help.